Hi, it's Dr. Centeno, and today we're going to talk about, is it possible to recover from CCI or craniocervical instability? Last week we talked about rehab, and this week we're going to talk about why some people might not be able to recover, or what they need to do to maximize their chances of recovery. So, as you know, I'm out for 6 weeks, but I prepared 5 lectures on CCI topics that will be on YouTube and Facebook Live, Fridays at 1 p.m. Mountain, 3 p.m. Eastern, noon Pacific. And the goal is just to obviously get more information out there each week so that everyone maybe isn't getting their questions answered, but at least there's a steady stream of new info. So craniocervical instability has lots of different parts and pieces to it, or at least as I view it, things that can inhibit recovery. So we see that wall in the middle there and then recovery off to the right. So things like systemic inflammation, arthritic changes, neurologic irritation, multifidus atrophy, lack of lordosis, kyphosis, scoliosis, all of those things can lead to a lack of recovery. And they can all be barriers or obstacles to recovery. So as a CCI patient, understanding what these are and understanding which of them are important for you is critical in trying to make sure that you can maximize your chances of recovery and getting back to where you used to be. So the first ones we'll talk about here are changes in shape of the spine that go the front-back direction. And that's no lordosis or lack of lordosis. So that's a straight neck, for example, a neck without a curve. And that's going to put too much force on the upper cervical ligaments. And there's 2 possibilities then, right? One is that the force can be overcome by orthobiologics procedures that cause healing in those ligaments, in which case you'll get to recovery without doing much to change that lordosis. The other is that it can't be overcome and the patient needs to go through curve and postural correction in order to get to recovery. The other thing that's important there, and I talk about this all the time, is kyphosis. We all sort of do this as we get older and we start to look at our phones all day, etc. And that's called kyphosis. So we want to get rid of that kyphosis, and it's the same thing here. Some patients will need curve and postural correction, some won't. All of them should probably try, right? We want to take off as much force from those ligaments by changing that overall posture, curve in the neck, forward head, and rounded shoulders position. Now the next one would be scoliosis. Now we're looking at left-right issues in the spine, and that's when there's a bend in the spine, sort of side bend, if you will. And what that's going to cause is too much force on one set of the upper cervical ligaments, right or left. And you know, we're going to get into a world where, let's say, the scoliosis can be corrected, in which case someone gets to recovery because now they don't have imbalance in the forces in those upper neck joints and ligaments from left to right. Or the scoliosis can't be corrected, in which case there might be no recovery or short-term relief. That might be a patient, if they have a severe enough scoliosis, that can't be corrected, that we may need to treat on an ongoing basis. So those are all things to consider if you've got scoliosis. Now, scoliosis can be treated with things like Schroth physical therapy. There are procedures that we can do to try to help it. Obviously, there are surgeries that can be done as well. Next would be multifidus atrophy. Remember, those are the small muscles that stabilize each individual spinal segment. In this case, the upper neck deep stabilizing muscles that help to stabilize the head on the neck, also the suboccipital muscles. Now, those atrophy in many of our CCI patients. Atrophy means get smaller, they get weaker. Now, stability is half muscle, half ligament. So we've got to get those muscles back online. And that can be done by just movement, right? You fix the ligaments, all of a sudden the patient can do more, they get more active, and just that strengthens the multifidus enough and they get to recovery. Other patients will need specific exercises to get those multifidus muscles back, again, after things are stabilized from a procedural standpoint. Another one is neurologic irritation, right? Lots of different nerves can get irritated in CCI. The lesser occipital nerve, greater occipital nerve, third occipital nerve, which all kind of refer pain up into the head. The vagus nerve, we've even seen patients with irritation of cranial nerve 12 that goes to the tongue, or cranial nerve 9 that goes to the back of the throat. Now, in this world, what I tend to see is this is where time makes a difference. In some patients, as time goes on, they're going to get irreversible damage to those nerves. In other patients, that damage, so to speak, is imminently reversible through doing things like platelet growth factor hydrodissection, meaning we can put platelet growth factors that can help the nerve heal around the nerve and try to get that nerve healthier and reverse some of that mild damage. But again, this is where time becomes important in getting CCI treated, because I see patients where they're gone too far. This has been happening for 5 years, 10 years, 20 years, and those nerves are not going to respond the same way they would have had it been caught within that first year, second year, third year, etc. Then we've got arthritic changes. And in the context of CCI, we're talking about arthritic changes in the upper neck joints, the C2-3 facet joint, the C1-2 facet joint, the C0-1 facet joint. Those are all joints in the neck that if they get too much wear and tear because of the CCI, then you end up with arthritic joints. Now, if it's a mild arthritic joint, again, pretty easy to reverse it with orthobiologics. But if it's been going on a long time and the joint is very arthritic, that patient, even though we may be able to get rid of the instability through tightening down the ligaments through injection, they may have ongoing pain coming from that arthritic joint, and they might need periodic injections in those upper neck joints to keep them as good as possible every year, every other year, etc. But again, hopefully if you catch it early enough, all of that damage of those joints is reversible. And then we've got systemic inflammation, right? That's the inflammation we all get as we get older, or many of us do. It tends to happen more as we get older, gain weight, get high blood pressure, etc. That's called metabolic syndrome. So we want to try to control as much as possible that metabolic syndrome. And there's some simple things you can do, right? You can start eating healthy, staying away from all the carbs and fast food, and going to more of a low carb type diet. You can also get rid of all the fake vegetable oils out of your diet. That's a good way to help. You can also take supplements that can reduce that systemic inflammation, things like high-dose fish oil, curcumin, turmeric, etc. So there are ways to manage systemic inflammation, but when that inflammation is high, things hurt more, including the CCI area and including that right ankle that you hurt 20 years ago. So again, if we can tame systemic inflammation, that's more likely to get that person back towards recovery. If we can't tame it, then we might get into a partial recovery or short-term relief situation. So in essence, recovery from CCI is possible, but getting your ligaments stabilized through procedures like the PICL is really only one component. Identifying which parts and pieces also need to be treated is another component. And it's really critical to understand that you know what those other parts and pieces are. So for instance, I'll often tell my patients, you've got a kyphoscoliosis, Going to have to deal with that at some point because it's putting pressure on those upper neck ligaments. Or you've got some joint arthritis at C2-3, and I'm sorry, this has gone on for 10 years. The arthritis is pretty substantial. We'll get you tighter. Maybe that'll help the arthritis, but we may need to treat that arthritis periodically. Or, for example, you've got a loss of curve in your neck. You're going to want to get that curve back, which is going to help what we're trying to do. So recovery is possible. Just identify what those issues are and pay attention, certainly when I tell you that there are other things happening here. So again, if I talk about you've got a scoliosis on top of this, then that's something that you're going to have to take a look at, and that's something you may have to get addressed. So thanks so much for watching. Have a great day, and I will see you